before leaders put out and the governor, it's worrisome. I mean, I think there's two takeaways that I would have from what I've seen so far. One is it appears the medical exemption is also unusually large in some areas from a statistical perspective. So we'll have to try to get a better understanding of that. But you have some schools where we saw medical exemptions as high as 20%. And that statistically seems difficult to understand, but it could be, but we'll have to look at that. And number two, for a long time, I think in the state of Connecticut, it's long been believed that 98.5% was our vaccination rate. And it's not, it's our statewide rate. And as the head of, at Hartford Hospital, the head of disease control said, we have pockets that are as bad as California was at the height of their outbreaks. So you have to take this sobering news and think about what you do next or where we go forward with this. But I think we're all pretty surprised. If you had asked anybody, I think, Liz or even Republicans that I had talked to who signed the letter, who felt that this was attacking people, we probably would have thought you had a handful of schools that may have fallen just below 95. I don't think anybody envisioned you'd have 108 elementary or 108 schools below that, let alone schools in the 60s or 70s. I think that's surprised everybody. So, Liz?
Yeah,
Liz, just point that 8 mic towards your mouth more than...
Yep.
Thank you.
Thank you.
We do have to take some time to further digest the data and triple check some of these numbers, but we need to sit back and look at them and decide what needs to be done and how we go about doing that. And I think that this is a conversation that is going to continue. It's certainly not something that we can decide overnight, so I look forward to a continuing conversation about that. But our main objective is to make sure to help kids, and this data is going to help us do that.
So did you, this doesn't prompt you to say that maybe you should accelerate your timetable for some sort of a ban on exemptions? The governor seems to be on board with something being done.
Again, I haven't had a chance to talk to the governor. I know as leaders, we put out a statement this morning. Senator Looney, somebody who's lived through measles when it was actually before it was eradicated, and so he has a very interesting perspective on this. I think we will get together early next week and have to have that conversation. There's no question this information is shocking and could change people's perspectives exactly on how we go forward. Yeah.
And if you look through some of the data, provided that the numbers stay where they are, we can look at that and see that there are some with religious exemptions that if the religious exemptions weren't part of that, then we would be hitting the herd immunity numbers. Because the data is disaggregated by religious exemption and medical exemption. And we can look at that and we can see that if we did decide to go ahead and eliminate the religious exemption, some of these schools would be hitting the herd immunity rate. We need to continue to look at that. That's an important point.
What do you think this report's impact could be? I mean, if you're in a school district, obviously those who are anti-vaccine feel this is discriminatory and, you're highlighting. But are you concerned about that in some school districts where people are going to see these numbers and may be upset about it that their children are being, exposed to viruses?
Yeah, I think that this information, for the first time in the history of the state, parents are able to drill down. And the problem with recent FOI requests and release of reports is by county and by state. So it gives a sense of comfort when Connecticut, looks like probably for years, has been lucky to avoid some sort of outbreak with our numbers. Our numbers suggest and indicate that it's only a matter of time that at one of these schools you could have an outbreak like you saw in California, New York. And when people talk about choice, what's frustrating for me as someone who, I think we all fully appreciate and respect religious freedom in this country and constitutional rights, when you choose to not vaccinate your child, citing a religious exemption, that is a choice that you make, okay? But that choice can impact other people. Religious freedom it does not allow you to put a cloak around yourself and ignore the realities of other people. It does not give you a blanket license to just do anything you want. But it is a choice to not vaccinate based upon a religious reason. For those with compromised immune systems, for those kids with cancer, that is not a choice. They have no choice but to not vaccinate themselves. And those are the kids, when you talk about choice, that I think we're sticking up for. We're not targeting anybody, but we are weighing the public health and siding with those folks who have literally zero choice about whether to vaccinate because of their immune systems.
One of the comments made to me yesterday from someone who is part of the Informed Choice Connecticut, when I said, well, what about these children? She said, well, they should stay home. And I said, well, some people feel that you should stay home. Is that a fair argument, do you think, that these children, for whatever their compromised immune system, that they're the ones who should not be in the schools?
No. These children with compromised immune systems deserve an education as well, and they didn't make the choice to not be immunized. That is a health reason that they're not immunized. And so when we are allowing freedom of choice, then that would apply to people who choose not to vaccinate. And for that reason, they're the ones that I believe should need to make that choice.
The choice of not
The choice of
putting
whether
their-
going to public school, private school, or homeschool.
And I would note another misconception on some of the things that I've seen is there is no bill that I've ever seen that would force people to get an immunization.
That's true.
To touch anybody or make anyone do anything to their children. In New York State, that is being litigated. It is so bad in New York that the governor and some officials have started to make a choice about forcing that. So again, by trying to get ahead of this and reduce the number of exemptions, you hope to never get to a point where a governor would have to make that decision. And there is no legislation to do that right now.
Well, are you surprised by the number of magnet schools and charter schools that had low immunization rates?
Yes.
Or is there?
I can't explain it. I have no idea, but I'm very surprised to look at the list and see 2 schools in Hartford. I never thought you'd see that at below 75%. It's shocking.
What is the level of willingness among at least your caucus, or perhaps in the wider legislature, if you care to opine, on tackling this issue? I mean, taking on the question of religious liberty and school vaccination. I mean, you have life and death issues, and people's religious beliefs, sort of in tension here and in conflict here. I'm just wondering, is this something that you guys could do? Is there support for this, I guess, is a short way of saying it.
Well, obviously there's going to need to be conversations and a caucus at some point to talk about where we are today. I think this information probably adds a different light on that conversation. If you're asking me whether this vote is somehow, this is not the kind of vote where leadership comes in and says this is what we're going to do.
Oh, no.
It's a very personal vote. Do I think the public is going to demand a vote at some point? Yes, particularly in light of the numbers. I don't know what would happen, but I think we can all acknowledge that there's a problem, and there's a problem in several schools, a couple of dozen schools at a minimum, and you have to address it at some point. If you're asking me, do I like, and you could probably ask Liz the same thing, how, when you put yourself out there, the things you have to go through, no one likes that. But at some point, the reason we are seeing low vaccination rates in this country is because junk science has gone unchecked for a very long time. And people are afraid or don't want to be bothered with what comes with taking on this issue. They don't want to deal with the social media. They don't want to deal with their colleagues because it's too scary, it's too frightening, it's too time consuming. Why be bothered? I ran for office to make a difference and to protect people. So am I willing to take the shots? Yes, I am.
Liz, your thoughts?
Agreed.
Well, could you elaborate a little more?
Sure. So this has been one of my top issues for many years, and I will say that one of the schools on this list is a school that my daughter was looking at going to. So this is an issue that I understand is a hot button issue. I think what happened yesterday, we all know, is indicative of the fact that there are high emotions on both sides. But I will say this, after the news came out yesterday of the fact that Majority Leader Ritter and I had a veiled threat on social media for moving forward with legislation regarding vaccinations, I received more of an outpouring of support from people who have said consistently that they were afraid to say something on social media because they were afraid that they would be attacked as well. I received emails from around the state, not even just my constituents, who are thanking me and then asked me, you can put out my email, but don't use my name because I'm afraid of what's going to come to me next. So when Matt Ritter had just said that it was a scary vote to take, I recognize it's going to be a scary vote to take if we decide to move forward with this. But what my job is as a legislator and a colleague is to take this information and go to my colleagues and say, the numbers are going to back us up. And you don't, I'm sure there is no legislator who wants the kids in their district to be at risk. So I think with this information coming out, it might be an easier conversation, but please remember that not only is it going to be difficult for myself to come out and always talk about this, it's difficult for every legislator. And so I would ask that the community stand up and contact their legislators to let them know that this is important to them and so that they understand they have the support.
And Paul, sorry,
Sure.
I just finished one thought too. I think some of our members still want to see the Attorney General's opinion. I think that's going to be an important consideration on the constitutionality issues. We expected sometime in the month of May. Obviously, they're busy people. They have to work on it, but I think that's a big thing for caucus members to review as well.
And then, so how quickly after the Attorney General's decision do you think that you will move forward with this?
I don't know. This is all so new and raw. I think we really have to process it. I think the governor, and for a while, let me go back to what some moderates said to me who signed the letter that went to the Attorney General Tong. What they said to me was, we agree with you that you need to have high vaccination rates. And so when you say that we need to be at 98.5% and all that, they're like, we're with you 100%. The problem is you guys are being too strong and too aggressive because we don't have rates so low like California to justify getting rid of the religious exemption. If you had statistics that showed that you were that low, we'd have a different argument. But you are writing this letter to get rid of it when there's no crisis. That was what they said to me.
What's the threshold then, and what would Connecticut have?
Well,
to
I
meet?
think the people who signed that letter have to now ask themselves, what is the threshold where they would consider it a crisis? And my gut tells me that some people who signed that letter probably wish they didn't. I could be wrong. That'd be my gut when they see these numbers. Because they were saying, I would have thought a handful of schools maybe were below 95, right? I mean, I would tell you that truthfully. No one expected this. So I think it is now a public health crisis. You now have the governor weighing in. You now have all the legislative leaders weighing in. So I think the question's got to go, all right, the world has changed a lot in the last 24 hours. Where do we go from here?
So just a question is the door open perhaps to doing something this session? Given that this report's going to come out sometime in May, maybe it might be the end of May, is there enough time? And then I guess the second question is, does this even need a legislative solution? Are there other ways, public education or ways to quell people's anxiety about these shots? And people can say maybe they're legitimate concerns or maybe they're not, but people do have them about, the pharmaceutical industry's role and things like that. Are there other legislative solutions that you could look at, perhaps that would address some of those issues as well?
Yeah, I don't know. First of all, I think we need to have the Attorney General's opinion as a next threshold, and that may not come till, I don't know. It may come to a point where it's hard to do it. It could be a topic for a special session. I don't know. You know what I think will really tell people what's going to happen this session is, what does the public say, right? For the first time in the history of the state, every parent is now control F-ing their school. And those are the parents that have never come up here, never testified, because they didn't feel a need to. Because they said, I don't even think most people know we regulate vaccinations as a state law. So I think the next 72 hours, when you all write your stories and you see the rates, that may drive what happens the next few weeks, quite frankly.
I think the education campaign has been happening on a national level for so long, and it's still not getting through. You mentioned junk science. I say pseudoscience. All of these things, there has been plenty of information and study after study that show that vaccines, for the most part, are safe and effective. And so for herd immunity to happen, we usually put the cutoff at 95%. And for measles, we have outbreaks across the country. We're not, if this had come before us years ago where we said a public information campaign could be beneficial, I think we're a little bit past that. If you look at the numbers on here. So I think that the two should probably work in concert with each other. We need the public information campaign, and I'm still believing that we need to eliminate religious exemptions. With that said, I think that it's important to reiterate what he just said, is that we need the public to come out and say what they want us to do. This is the time to speak up. And if you look all over social media, people are starting to do that. And we need to hear from everyone. Please call your senators and representatives and let them know after you control F your school, and let them know, say, hey, my school has a very low vaccination rate. I want to keep it that way. Or my school has a very high vaccination rate. I'm wondering why, and I think that we really need to eliminate the religious exemption. It's going to be important to hear from every parent in the state of Connecticut.
Don't the local
Opposite.
public health officials have authority to issue quarantines and things like that?
No.
Sure they do. Of course they do. They did it when we had the anthrax outbreak here.
My understanding is when it comes to this, and our statutes are not as entirely clear as other states, which have a far better process, is the governor can order it. He can order a health emergency.
Right.
But there is no authority that we could find in state statute that would allow for a local health director to do that at the schools.
Oh,
We
is
believe
that
it has
right?
to be from the governor, yes.
Yeah,
We can check that, but my staff's been looking at it. They did not see anything. It's not really well detailed in statute, quite frankly. Yeah.
And some of these folks also make the argument that, I understand the argument with regard to the medically jeopardized kids.
Yeah.
But with regard to other kids, that there's nothing wrong with getting the chicken pox when you're a kid. You said Senator Looney, I had them too, and I'm still here. It was considered, when I was a kid, it was considered a childhood illness, and you were out of school for a week, and that was it.
I can only support what the CDC recommends, and they recommend that people get these vaccinations.
I mean, it can be serious among older people, but so is wisdom teeth.
So, I actually had a call from a teacher who was asking me another question about, what about the teachers in all this? How does CEA and AFT feel? If I'm a teacher who has a medically compromised immune system, if I'm a teacher who's pregnant and I'm at one of these schools, am I going to ask, what about my rights? Religious freedom is one of the bedrocks of this country, but it is not a ticket to do anything that you want. When your choices have the ability to negatively impact other people, particularly in the public health realm, it's not freedom. It's not religious freedom at that point. It's decisions that you are making that can negatively impact others, and the state has a right to regulate that as long as it's reasonable. And if we had a 98.5% rate, or 97 or 96 at every school, I told a colleague from across the aisle, I said, if that's what the data says, I would probably just want to do a public information campaign. I would have no desire, because at that point, you're right, we have the herd immunity. That's not what happened here. It's shockingly low. Yeah.
But I think the religious exemption too, I mean, if you talk to some of these people, they'll admit to you that that's not why, they're using that as a way to circumvent or get away from the vaccine. And to be very honest, I say if their religion is because they're concerned about autism, that's what they're using, but it's not a religion.
And in 2015, when we started this issue, right, when I looked at the form way back then, and now, I have never received an email from a member of a clergy or anybody saying my congregants are being affected by this. I've never had anybody who you would consider a religious figure say to me, it's our religion. I've had a rabbi say, I'm with you, let me know what I can do to help. And another thought too that no one's talked about with these rates is, the vaccination is not 100% effective. And some will use that argument to say, see, why should I be forced to get it? It's not 100% effective. That's further reason why you have to have high rates. It's not just medically compromised children. There are some children for whom it will not work. So that's adding other people in the classroom who may be susceptible to contracting these diseases because of that. So that's why CDC says you got to be at a certain rate, because there is a small fail rate of a couple of percentage points.
But you can't really test people to see if they're actually religious, because the Supreme Court ruled in the Muhammad Ali case that you don't have to be part of an organized religion.
You're right.
It can be a religion of one. I believe this.
You're right.
Yeah.
That's why you have to get rid of it in statute. You can't have people going to court to, right? You can't do that. I agree. If you could, you might be able to find some middle ground, but you can't.
Okay, go ahead.
No.
I was just gonna ask again about the school nurses bill, since you brought it up. You have said that you made a commitment that you would not offer an amendment to that bill. Well, that's you. There's 186 other people here, and Senate President Looney, after that news conference, he was suggesting that bill be used as a vehicle to repeal this. So where do we stand on that question? Will you support an amendment? You may not propose an amendment. Will you support an amendment if one is offered? Do you expect one to be offered?
Well, I think, first of all, I haven't spoken to Senator Looney, and I was not aware of that statement, so I can't speak to what he said. It's hard to say would I support it. I would ask my colleagues to allow me to keep my word and not do that. However, I can't vote against something that I believe is the answer to a public health crisis. So I have pledged that I will not put that forward, and I have had some colleagues pledge to me that they would not do the same. So that is as far as I can say, but I can't control everyone in the legislature.
I got a little more control of the floor, and I will say this: 7002 will not be the vehicle.
7005.
7005 will not be the vehicle.
Okay.
How's that?
Want to say that again?
All right, it will not. And the fixation on that bill, I don't really understand, other than to say, if there's gonna be, if people feel we need to do something more immediately, that'll be a decision. That decision hasn't been reached yet.
Yeah.
No one's even looking at vehicles. I think we need to sit down as leaders and our governor and our public health commissioner and see what they recommend. This is all just so new. There's no set plan or path forward
Is
at this
this the
point.
bill that we talked about, the one that reminds nurses that
Yes.
they have the authority?
Yeah, the one that passed committee
Yes.
the other day.
That will not be a vehicle for I mean, it might be put up for a vote, but it's not a vehicle for this. This is a bigger issue. And
This is clear.
And the medical one, look, we're focusing on religion. This is another thing that's come out is the rates of medical exemptions in these districts, they are not statistically possible, is what we're hearing from doctors who have sort of weighed in already. So that's another angle I've never even thought about. We sort of assumed the medical was sacrosanct. I have concerns about that now too, and how do you go about that? This is a really startling bit of information, and it's a puzzle we have not put together.
Right, but the medical exemptions can very well be like getting prescriptions for opioids. Doctors say, oh, you're in such pain, you can have an opioid. You know, doctors just write these prescriptions. We know they've been doing it. That's why we have an opioid crisis. They may very well be doing the same thing. If mommy comes in and says, oh, I think he's precious, he's gonna be harmed by this, and the doctor says, oh, okay, here's your medical exemption.
I ain't a doctor,
Yeah.
and I didn't go to medical school, but I think the Hippocratic Oath and statutory schemes would require
Yeah,
that
but
they
that's
take
not
it very seriously.
That's not doing any harm
Well, it's not doing any harm.
by writing an exemption.
Yes,
I
it
believe
is.
it is.
That's adding to the rates of unvaccinated children.
Well, I get that,
Right.
but they may not interpret it as doing any harm to their patient.
Yeah. Well, this is something we have to look at. I did not expect to see medical rates so high. Yeah,
Yeah, I think that's surprising too.
it is. So this is, and I think the medical society, we'll have to talk to them, see what they think and how they'd recommend. This is a big puzzle, and look, I'm just glad that the governor and others are engaged on it, and we'll see what the path
But
is.
also
forward.
the population is changing. We know that,
Mhm.
with immigration and everything else.
So if you look at the vaccination rates of a lot of South American countries, they actually have higher vaccination rates than a lot of states in the United States. So I often hear the argument that maybe our vaccination rates are going down because people are immigrating to Connecticut and the United States. Given the data, I would say that that's untrue.
Very good comment.
Thank you.